Hi, I'm Dr. Will. I'm here today with Angie, and we're going to be delivering her HAwley retainers for her today. So let me just get a pair of gloves on here, and Angie, I'm going to explain to you how these retainers work, and then we will actually try them in your mouth and have you practice as well to make sure that you know how they go. Okay? So first of all, Angie, a HAwley retainer is a acrylic on the inside by your tongue or on the top of your mouth on the palate with a little wire in front that holds the teeth in place. And retainers do just exactly that. If we can get a little close-up on this here, a retainer just holds the teeth. It's not meant to actively move the teeth to any great degree. So Angie, if you would just hold this one, please. This is the lower one, and I'd like you to notice the difference between the lower and the upper. You see how the upper one has a much larger area of coverage of the acrylic, and the lower one is more cut out to allow your tongue to move freely. Because you will be wearing these retainers 24/7 except when you're eating.
Okay.
All right? Would you hold that one for me here, please? I can get a mask on, and I'm going to show you how these work in your mouth. Okay. And I also want to have you practice this. So let me take the top one here, get a mirror for you to look in. You hold that, please, Angie. When you place a HAwley retainer in, you want to have the wire in front of the teeth. It only goes in one way, and you just push it in on the plastic portion on the inside, like that. Please, when you take it out, never push down on this long wire right here. Always push on the loop. Try it with both hands, like that. Okay? That's the top one. I will check that to be adjusted in just 1 second. Let me have the bottom one here. Same thing, only upside down. Wire goes in front. You push down on the plastic in the back part like that, and the retainer goes into place. And you'll notice that the wire is always on the outside of the teeth, both top and bottom. And when you bite down, close please, you will notice that you slightly touch the wire in the plastic. And that is normal because our teeth are only together when you're actually biting. So for a day or two, I know you're going to test this by biting down. It will feel slightly different, but that's very normal. Okay? Now let's review how to take these out, and then I'd like you to practice. On the top, get the top of the loop here, push down. On the bottom, we will do the opposite. We'll get the loop and push up, just like that. Okay?
Okay.
Now, I'm going to give you a quiz. I'm mixing the retainers up here, so you have to decide which one is top and bottom. Grab whichever one you want. Okay, and I'll hold the mirror for you.
Okay.
All right, that's the top one.
Yes, it is.
There we go. Wire in front, push up on the plastic. Beautiful job.
Okay.
So obviously there's the bottom one. You are such a fast learner.
Thank you.
Great. Okay, now Angie, I'm going to check those to see if there's anything I need to adjust on the retainers to make them fit a little more properly. The wire is beautifully adapted to the teeth there. No, let's just leave these alone. I want to give you a case to keep the retainers in. Please use this case. You want to hold that for me, please? I'm going to take these out one more time so we can show how we use the case. If you have a little animal, little dog around the house, and you leave these out, I guarantee the dog is going to find them, because these do absorb a little odor. We can't smell it, but your dog can, and the dog loves you. It's going to try to chew the retainers up. Always keep the retainers in the case when you're not wearing them.
Okay.
Don't put them in a napkin when you go out to eat. I had so many patients lose their retainers that way. And like I always enjoy telling patients, you'll never lose your retainers if you have them in the mouth where they're supposed to be.
Okay.
Okay? Now, let me just lastly give you this information here. This just reviews what we have talked about, Angie. I'd like you to take this home, keep it where you have your information for your orthodontic treatment. If you have any questions, please call us. And other than that, we will see you back at your next appointment to check the retainers, make sure everything is going well, and follow up that you have had an appointment with your dentist to get your teeth professionally cleaned and everything checked now that your braces are off.
Okay,
Any
Dr.
questions?
Will, yes.
Yes.
How long do I have to wear my retainers for?
Good question. Thank you. I'd like you to wear your retainers for 1 year, full-time, 24/7, and that means no holidays, no days off, just when you're eating, okay?
Okay.
After that, that's the second part of your question, how long do you wear your retainers? I'd like to suggest that you wear your retainers at night while you are sleeping indefinitely. It's the easiest, most effective safety net insurance you'll ever get, that your teeth will remain the same as when we took your braces off.
Okay.
All right?
All right.
Thank you, Angie.
Thank you.
Delightful to have you as a completed patient.
Thank you.